Hello, everyone. My name is Subarna, and I'm so happy to welcome you all to the fourth annual Cannabis in Practice webinar series hosted by the Washtenaw County Health Department in partnership with the Washtenaw County Medical Society. This virtual series is aimed towards healthcare providers with the goal of raising awareness and opening discussions surrounding cannabis use for medical practices. Our speakers come from a wide range of backgrounds and are experts in their respective fields related to medical cannabis. Funding for the series comes from the Michigan Department of Licensing and Regulatory Affairs, Cannabis Regulatory Agency. I'm so pleased to introduce today's speaker, Teesha Montague. After 10 years of service as patrol officer and then in financial services as the coordinator of collections and student payment plans at Washtenaw Community College, Teesha Montague headed to Oakland, California, where she attended Oaksterdam University, the first university dedicated to the education and destigmatizing of cannabis. In 2017, Ms. Montague became the Director of Operations at Huron View Provisioning Center, the only locally owned and Black women-led provisioning center in Washtenaw County. Over the years, while working in the medical cannabis field, Teesha has developed a passion for coordinating and creating veteran-focused programs and referral services at the facility. During the COVID-19 pandemic, she created the Veterans and Senior Meds and Meals program after noticing there was a consistent need beyond cannabis amongst their senior and veteran patients. Prior to her position at Huron View, Montague trained and worked with various organizations such as the Wayne County Mental Health Department, the Veterans Resource Center at Washtenaw Community College, and the USDVA, organizing specific initiatives to support the needs of veterans. Teesha Montague and her mother, Christina, owner of Huron View and a former social worker, have made it their mission to help veterans, delivering meals, spending time educating, and talking both at their homes and at the dispensary. They even started a counseling program and veterans peer group. Montague's leadership skills are demonstrated through her current and former service, which includes serving as the Vice President of the Michigan Association of Student Financial Services Administrators, an advocate, spokesperson, and board member of the Ann Arbor Club of the National Association of Negro Business and Professional Women's Clubs Incorporated, a national entrepreneurial resource and nonprofit organization, founder of the National Association of Minority Women in Cannabis, and owner of both Queen Supreme Cannabis and GI Ganja brands. Thank you so much for joining us today, Teesha, and I will let you take it away.
Thank you so much, Sabrina. And thank you all for being here today. As Sabrina mentioned, I am a graduate of Oaksterdam University, and that is why it is so important as learning about this plan and veterans and the use. And we wanted to give our perspective now that we are in the space and that we see these people and see these patients and how this is benefiting them. So today you'll receive a community provisioning center's insight on aiding veterans and medical cannabis. Before I get started, I just want to do a quick disclaimer. The information discussed and contained within these slides should not be considered to be personal medical advice. This should be used for informational purposes only. Reference to any specific product, process, or service, or the use of any trade, firm, or corporation name is for the information and convenience of session attendees and does not constitute medical advice, endorsement, recommendation, or favoring by the Washtenaw County Medical Society or Washtenaw County Health Department. Nothing can replace the relationship patients have with their medical providers. So today we've heard a little bit of my background and history of working with veterans, and we're going to talk about identifying the needs of veterans, breaking down communication barriers, common questions or concerns veterans may have when discussing or beginning cannabis or CBD use, ways to safely consume or absorb cannabis and CBD, dosing, benefits, how to safely access cannabis and CBD, research and studies. And then finally, we'll end it off with some questions that you all may have. So as far as my industry experience, we have been working in this space since 2015. We have developed many programs. I've obtained trainings and certifications, but most importantly, I've developed that relationship with our veteran community. And some of those on-site referrals and on-site services that we provide for them has been instrumental in helping them just in their daily lives. So some of it may not even have to do with cannabis consumption. We may refer them for a meal through our Meds and Meals program. We may call MICM and say, hey, we've noticed that someone may be having a manic episode. And so we develop relationships and rapport. We may refer them for some socks or pillows or different items from different organizations that are servicing people of their constituency. So it's been really helpful, and it's been really self-fulfilling for us to be able to give back to the community in so many different ways that help them in their whole entire life. So first we'll begin with identifying the needs of veterans from their perspective. And you know, you see this picture is kind of blurry. I put that picture on purpose because sometimes we don't know what they need. They don't know what they need. They don't know how to communicate it. So sometimes we have to develop that veteran and patient comfort zone. We have to be able to break down those barriers and talk to them. And they're already apprehensive about coming to the doctor or coming to speak with someone. So you have to maybe break down that barrier of communication by, you know, something that they mentioned or a pet that they talk about all of the time. Or perhaps they went fishing and they caught a big fish and you remembered that from their last appointment. Maybe bring that up, but no, let them know that you're active listening. And that has nothing to do with, you know, cannabis. That's just developing that rapport and that camaraderie between yourself and that patient. Because some patients have so many different ways that they medicate and why they medicate and why they do so and why they choose this over that. And so we want to find out. We want to know. And so by breaking down that barrier and working with them and discussing with them and letting them know that you hear them, that helps just with developing and having that conversation, because we have to break down that wall. And so, you know, when we ask them, you know, why do you choose cannabis to combat your pain rather than other medications? They say, oh, well, it gives me, you know, the chills, or it makes me feel like a zombie, or it makes me dizzy, or I sleep too much, you know, so I'd rather have cannabis. It makes me, you know, I'm up, I'm able to do things, I'm able to continue my day and get through the day, and I don't have all these side effects, you know. And so I think it's important that you really have that conversation so that you know, and maybe there are some medications that you can work with them and maybe it's some ways that, you know, you may not recommend that they, you know, utilize cannabis, but you may say, hey, okay, but can you do this because you have this going on? So, you know, breaking down those barriers, becoming a listener and asking them why, I think that helps them get to, you know, to those whys and their concerns, because, you know, some of their concerns are, you know, they're going to lose their benefits, or I'm going to go to jail, or am I going to lose my medical insurance, or housing, you know, my housing, I can't smoke, or the people have complained. And so we want to make sure that we know why they're apprehensive, what concerns they are, discuss those concerns, you know, let them know they will not lose their benefits for choosing this. Well, you know, there are things that can be put in place, and there are things that they can do for medical that they have been doing. But I think that it's really the concerns that we want to try to have that conversation to alleviate and be able to, so that you have a general understanding on what they're going through. And then, you know, accessibility, you know, how do they get it? How do they safely get it? How do they go about it? You know, so we want to discuss all of that with them. We want to make sure that they are aware, and they are, and how and how to do so in a safe manner. So with that being said, I want to talk about ways that they can safely do so, or ways that they can safely absorb this product. Okay, so there's so many different ways, there's so many methods and different products out there on the market now, but we're going to talk about 4 major ones today. And so we're going to begin with the oral. So when you think about oral methods, you think about by mouth, usually by eating an infused food of some sort, whether that's a gummy or a candy or a beverage, or some put it in infused, they take the honey that's infused and they put it inside of their tea. Then some others may make their own butter and they may cook with it. And so they medicate that way because, you know, sometimes the smell may bother them. And so a lot of times you'll find people may choose to do so in that way. And then there's also a tincture method that you can also drop a tincture onto your tongue. Now, there is a second option that's called a topical. So generally topicals are like going to be your rubs or your lotions, okay? These are ointments. These are things that they're going to rub on their joints, on pain. I've even seen where ports have been and they've rubbed some of the ointment around that, either CBD or THC or a combination of both, where they rub that ointment actually directly on there to help with that pain and help with healing. And then another option would be our sublingual. So sublingual means basically where it's dissolving under the tongue. So, and when you have sublingual products, they're usually a dissolvable capsule of some sort or a tincture, and it's dropped underneath and then it's ingested into the body that way. The final method that I'll discuss is going to be inhalation. So the inhalation consumption method involves like where flowers rolled in a paper, commonly known as a joint, or in a concentrate, and they call it dabbing, where it's heated up. The cannabis is heated up. A concentrate is heated up to a less than solid form usually, and then utilizing it with a dabbing tool or a rig. And so those are some of the ways that we've heard that they consume and that we know that has they've utilized in the past. So we discussed some methods that some veterans choose, and you know, for instance, no veteran is going to medicate, or it's not going to be the same way for everyone. You know, one patient may have a bronchial issue, someone may have arthritis pain. So there's not a one size fits all with this. And as far as dosing and expectations, when it comes to dosing, we want to start slow and low. We want to gently see what works. We don't want them to over medicate and crash from the beginning. They have to be able to choose the method that works for them. As I mentioned, you know, someone with bronchial issues is not going to want to have an inhalation, you know, where they are taking it in. Someone with, you know, arthritis or back pain is, you know, they may not want to have a sublingual. They may prefer a topical. So choosing the right method based on what you are utilizing for is very important. And then after you choose that, you want to make sure you talk about how often we use it, the frequency factors. How often are you utilizing this? How often do you need it? How often is the pain there, or does it address the pain? And so we want to make sure that we talk about that and have them properly dose themselves. As I said, starting slow and low. And we want to, as you see on the screen, you can almost, I would encourage those who are starting early to definitely be aware and write down, hey, this worked for me, this didn't work for me. And so that's what we encourage our patients to do, because sometimes they'll say, hey, that was good, I like the taste, or I didn't like the taste, but it worked well. So different factors on why they use it. They didn't use it, it helps, but they didn't like the way it tastes. So it's a lot of different things that we have to take in consideration. And then over medicating, we have to be very careful on over medicating. You want to decide, you want to talk about that relationship on THC to CBD as well, because I find that patients who are new, or now it's a lot regulated. The system is regulated and the industry is regulated, and it's getting, more and more regulated. So I believe that it's a lot easier to not over medicate these days. Whereas, 4 years ago, 5 years ago, you could come in and, you get a brownie and it may be 700 milligrams. Well, if someone eats that whole brownie, they may not be feeling so well. Also, we encourage them to have CBD on site. CBD is a non-psychoactive in THC in the cannabinoid plant. It is the non-active, so it doesn't affect the mentals or the head. It's more of a body relaxation, where it attacks the pain or inflammation in the body. THC does that as well. They have strains that are hybrids, but THC and CBD together we call it a beautiful relationship, because it helps you kind of properly dose, and it keeps you from over medicating, because it's almost like a scale balancer. So, and continuing on with dosing and expectations, I have a dosing chart here just to kind of talk about how, a novice, whereas that 5 to 10 milligram zone, that slow and low, and these folks may have, mild things that they would like to take the edge off, or they use it to a gummy to go to sleep. So those are the smaller dosages where they're utilizing those milligram dosages. And then you're going to move up to that intermediate level where it's the 25 to 50 milligram, and they use cannabis to combat pain. They know the effects. They know what they need, and they know that they need a little bit something stronger than that 5 to 10 milligram range. And sometimes these are veterans who are patients who have like severe pain or terminally ill, or those are between that 50 and 100 milligram range. You see those chemo patients and those dialysis patients, and people with those pores that I talked about, and those severe stomach conditions. And so we see them having to utilize a little bit more, a higher dosage, and a little bit more frequently. But as we said, we would like them to be responsible, and we teach them to be responsible, and we teach them about dosing, and we teach them about how much dosing. And so we definitely encourage them, as I said, to begin at a smaller dose. And as tolerant time goes on, or as you say, hey, I think I can, a little bit more will make me a little bit more comfortable, then we encourage them to do so. But that is, again, based on individual experiences. And so right now, I'm just going to talk about a few common cannabinoids and cannabis strains and CBD strains, because these particular strains we have had in both THC and CBD strains and cannabis strains. So the flowers available, and these strains are universal. So like our first strain I wanted to talk about will be Gorilla Glue. It's a hybrid strain. It usually is around the 26 to 20% THC range. And it comes in both CBD and THC, and that hybrid allows you to have the relaxation to relax, but also enough energy to get things done, so it won't have you super couch locked. Then there's a Northern Lights, and some of the original strains from this Northern Lights strain, they're all across the world, but they actually hailed right here from in Northern Michigan. And that's an indica. Usually sometimes people cross it and things like that, but it's a really, really level strain. It's very relaxing. And then you have Skywalker OG, which is another indica and another relaxing for pain. And then we come to those sour diesels that actually has a little bit of CBD in it as well. That sour diesel and Blue Dream, they're more like a sativa hybrid-y, and they lean, which means they have like uplifting properties, and they're creative and euphoric, and the effects are somewhat relaxing, but still, able to get things done. And I think these strains are really popular because of their properties and because their appearance. Those properties are essentially what provides those effects in that THC, potency. It gives them that bright color, gives them those green and those red hairs and that deep purple. So appearance, I believe, plays a major role when when people tend to make choices. And my veterans are very, very they know what they want. They're assertive. They come in, and sometimes they want the same thing that they had last time, and if you don't have it, we better have something pretty close. And so they know what works for them, and once they find something that works for them, they usually like to stick to it. They don't like to, I noticed that they don't like to switch up and jump around. Someone may prefer, a bushier more, or someone may prefer a denser, type of flower, but all the time they are always checking out that bud structure. They, some of them say, hey, this is what I got, last time, and I want this, and it was amazing. And so they said the terpenes, were amazing. And so the terpenes is what gives you the smell, so terpenes are basically the primary constituent of the essential oils and are responsible for the aroma characteristics of cannabis. And cannabinoids, you'll hear me talk about cannabinoids. They're a group of related compounds which include active constituents of cannabis. So it's like basically THC and CBD, those are cannabinoids, things like that. And the terpenes are going to give you that smell, and it's going to give you, I have the people, when they're selecting their flower, when veterans are selecting medicine, we have them smell it. And I pay attention to their body language. And a lot of times, if their eyebrows perk up, then I know that's going to work for them. That strain is going to work for them because their body has already responded to it. If you see they squinch up with their nose, or, oh, that's horrible, or I don't like that, it may not be horrible, but to them, it just didn't work for them, And so, so we have to talk about that. And so that's where all those different terpenes come in. And, there's 150 different terpenes and 100 cannabinoids. So, we'll talk about a few different terpenes, some of the main ones, like, let me see, myrcene, which is like found in mangoes. And it's been known to have antifungal and antibacterial properties, and it also acts as a sediment. So, a sedative, excuse me. And so basically what that does is, that those type of strains and those type of terpenes and those type of flower are going to give you that more relaxing. That's going to be more of that indica, that indica strain. And then you have the limonene, which it kind of sounds, it is what it sounds like. It's more citrusy. And they have multiple therapeutic benefits, mood enhancements, digestive improvements, anti-inflammatory properties. So you'll see a lot of different strains that some of these places are growing, some of these facilities are growing, or some of these dispensaries are offering. They'll have a different combination of some of these different terpenes. And then we have the caryophyllene. So that has a unique ability to bind to our CB2 receptors. Those CB2 receptors, they regulate like inflammation and things like that. And so the beta has a similar property as limonene, and it's also been known to help with relaxation and pain, and it helps relieve anxiety and reduce cholesterol. And also it's been reported that it helps to prevent osteoporosis. And finally, that is that component that helps with seizures. So we'll talk about how CBD is being studied right now to treat people with seizures. But terpenes the effects have reported to help with chronic pain, insomnia, back pain, anxiety, nausea, PTSD, weight loss, skin disorders. So there's so many benefits that medical cannabis and CBD have actually been reported to, help with and relieve people from. People are utilizing this to get through their day. It's something that a mechanism that they have utilized and has been successful for them. So from there, I just want to talk about some of the ongoing research and education that is happening in the United States, because there are some amazing groups and amazing organizations and wonderful things happening in the cannabis space. And I think that the National Institute on Drug Abuse, which is NIDA, it's a United States federal government research institute, and they get a lot of funding to look at so many different aspects and so many different plants and processes and drugs that are scheduled right now. And so I would encourage people to go out there and look, because there's hundreds and dozens more of CBD and THC studies out there. Then there's also DAN. I wanted to mention DAN, which is a veteran-led organization, and DAN is Disabled American Veterans. They have a really big, they just help the veteran for life. So once you are out of the service, they help you different aspects of your life, but they have really been discussing how veterans have been utilizing cannabis for their PTSD. And so I encourage you all to check out DAN. Also, something really amazing happened just in July of 2022. The CRA and Michigan legislators and Laura granted $20 million to the University of Michigan and Wayne State for veteran suicide research. This was huge. So I think it's about 14 million to Wayne State, and Michigan will get the remainder, something of that sort. But I know that the University of Michigan says that it plans to use those grant dollars to study the effectiveness of cannabis therapies to treat veterans with chronic pain, towards the goal of reducing veterans' suicide risk. And specifically, they'll actually be investigating the utility of non-intoxicating CBD in pain management. And Wayne State is receiving 2 grants for 2 studies. One will be randomized and controlled in this more large-scale clinical trial, and the other, and it'll examine whether the use of cannabinoids like THC and CBD could improve the outcomes for veterans with PTSD who are undergoing prolonged exposure therapy. The other grant will fund an ongoing clinical trial into the effects of marijuana on neural inflammation and neurobiological underpinnings of suicide, ideation, and veterans with PTSD. So we are making strides. Then you have the Federal Standards Handbook, who just recently received, which basically received a new section on cannabis potency, packaging, and labeling. This is huge. Federally, we're making strides. The Federal Standard Handbook, that's big. And you know, we talked about breaking down these barriers. We talked about having these conversations. We talked a little bit about these strains and dosing, and we talked about some research, past and present, and on this amazing plant, and how these amazing heroes, how do they get this medical marijuana? How do they safely access it? You know, what happens with that? Just really quickly, I just want you to understand that 75%, it's estimated that 75% of veterans are interested in cannabis in some type of form here in Michigan. And so that's a large number that are interested or are using it. And so we've got to continue this education so that we can break down these barriers and the stigma and help them. I just wanted to make a note, since the PTSD and different ailments, mental things, challenges are affecting our heroes. September is Suicide Prevention Month, and stopping suicide is everyone's battle. So if you know someone, you know a veteran suffering, or you know someone, please definitely reach out. Or there are many crisis hotlines. And opportunities for them to speak with someone to try to get some help. Now, I just want to do some tidbits on Did You Know? Did you know in March of 2018, a study was conducted by NIDA that shows CBD, the non-psychoactive chemical found in cannabis, marijuana, may help reduce the risk of drug and alcohol relapse. It also showed the reduction of anxiety and impulsivity. That's huge. That's huge just to have that study and be able to have that data. I think that's great. And I commend NIDA for continuing to do its research. And also it went on to note that CBD has been approved to help reduce or significantly decrease the amount of seizures epilepsy patients suffer from. So we have 4 epilepsy patients that we service, and they have been successfully using CBD, a combination of CBD and cannabis, for many years. That we are aware of, and prior to possibly, but I know that they say that it helps them, and that other times, sometimes their medication may keep getting switched up, but that cannabis was constant for them, and they knew that what they were going to be dealing with and the effects that they were going to receive from that. So I'm kudos to them for being able to find something that worked for them. But we want to talk about that, and we want them to safely be able to access this. So I wanted to give you guys a little bit of information on how they can safely access that cannabis. They can call us at Huron View Provisioning Center, or they can visit their local provisioning center. What needs to be, I want to be clear on, is every dispensary that is in the area or that you pass by, not all of them are provisioning centers. There's a difference between a dispensary and a provisioning center, and I wanted to educate people on that. Provisioning center is medical, and so you are coming for a medical purpose, and we are a provisioning center. We just happen to offer for adult use, but we first are a provisioning center, and then we are for the medical patients. So I just wanted to clear that. And then we have sponsored doctor days, or you can find a certified physician or a certification center. Now, some people may or may not have doctors who will go ahead and fill that paperwork out for the state for them. So it's an application that they will need to fill out to obtain that card, their medical marijuana card. And then they also have to then apply to the state. Now, the state fee, I believe, is $40. The physician fee may vary or even be free, depending on where someone would go. Okay. And then finally, again, if you know anyone who is in need of a meal, and they are a cannabis user for medical purposes, they're a veteran or senior, we do have the veteran and senior meds and meals program. We are revamping that program to do a big rollout in 2023. We've added a ton of restaurants. It's been a blessing to be able to pull different community organizations and businesses and local businesses together to help our heroes. So I'm excited about that and to be able to do so. Again, I want to do this disclaimer. The information discussed and contained within these slides should not be considered to be personal medical advice. This should be used for informational purposes only. Reference to any specific product, process, or service, or the use of any trade, firm, or corporation name is for the information and convenience of session attendees, and does not constitute medical advice, endorsement, recommendation, or favoring by the Washtenaw County Medical Society or Washtenaw County Health Department. Nothing can replace the relationship patients have with their medical providers. Thank you so much for listening today and taking time to learn. And if at this time, we will take any questions that you all may have. Thank you again.
Thank you so much, Teesha, for that fabulous and informative presentation. We so greatly appreciate it. And at this time, if you do have any questions, you can feel free to put them in the Q&A section or the chat. I did want to take this time to mention, and I'm going to add the link in the chat as well, but that all of the webinar recordings and slides, including this one from Teesha, will be added to our main medical marijuana webpage at washtenaw.org/marijuana. So I should say you can access the webpage recordings or the recordings from that link. And I do want to ask our first question, let's see, which is, do you notice any differences in apprehension levels or attitudes surrounding medical cannabis from veterans of different age groups?
Absolutely. It's one end of the spectrum or the other. So I would say some of the more senior veterans who have not tried cannabis in 40 years are apprehensive because they heard it's 10 times as strong, or they've heard that I'm gonna overdose or something like that. And so the education, we have to educate them, and we encourage them to start slow and low. And so we introduce products that will not be as vigorous for them. So yeah, sometimes now the younger patients, they're a little bit more savvy. They're researching, and and they know the strains that they want sometimes, or my buddy got something here. And so we get a lot of requests from some of our middle-aged and younger veterans, excuse me.
Great, thank you. And for our next question, how can healthcare providers help break down the stigma and the barriers toward medical marijuana use?
So I believe that we have to have that conversation and continue to have that conversation. And when you go to your different association conferences and on these Zooms, and when you're talking to staff at the hospital, we have to start having that conversation, talking to the patients, getting data, asking them, do they medicate using cannabis? Why? You have to really, it starts with just having that conversation so that people are not afraid to talk about it, because I think that it's so, so hush at now. It's becoming more because it's a business and things like that. But the medical piece of it is so, so important that we have to have that conversation right in our own circles. It begins in our own circles. It begins with our bosses. It begins at our jobs. It begins in the grocery store. You just have to have that conversation. And I believe that, starting with your colleagues, and what are you seeing? And, you have to have that dialogue, because then you can go and say, hey, 10 out of 12 of us are hearing this. They're utilizing this amazing plant. This is what they're utilizing it for. So yeah, I think just having that conversation and starting somewhere.
Thank you. Let's see. Our next question. Some have heard about concerns about pesticides in marijuana. Can you speak to that at all?
So it depends on the facility. I will say that there are so many different things, and outdoor versus indoor, so know your grower. You need to know where that product originated from. We tend to use organic growers, so they don't utilize those. A lot of the hurtful things that the state calls remediation, that's a different topic than today, but everything has something in it these days. And so we just have to make sure that we're working with companies who don't put the things that are going to be harmful to us in pesticides and don't spray. So I think just knowing your product, the state requires you to test. They also require you to say who it's from. You can find that information out. That's public knowledge. And so if you want to know, ask. Make sure that, and ask, hey, is that grower an organic grower? Don't be afraid to have those conversations.
And our next question. You've already touched on too about how it's really that discussion that you have with the patient to kind of see what strain works best for them. And you mentioned like watching their reactions and the raising of the eyebrows. But just out of curiosity, are there any particular strains you find that are typically preferred by veterans for medical cannabis use? Or does it really just differ person to person?
It differs person to person, but I believe that it's more so what strain is popular at that time, because it'll be in a lot of different locations. And so some of my senior veterans or seasoned veterans, as I say, they prefer some of the old school strains, the Monkey Paw, the Blue Dreams, the Gorilla Glues have been popular for about the last 10 years. The Diesels, the chocolate tie, they asked for chocolate tie stick. We haven't seen chocolate tie stick in probably 10 years around here, but they asked for the Sunshine OGs. So I think that it really depends, but some of those old school strains are more so the ones that they have been asking for. Yep, and seeking out, and they'll travel for them. I had a veteran come down from up north for Blue Dream that he read the reviews, and they were, reviews or different things. And someone had came down and they visited us and another, so it's a community with them, and they talk and they have dialogue amongst themselves. So they know what streams are working for them. And, so they know that, and if we talk to them as well, we try to help them through this process, because if they have, severe anxiety, we don't want to give them a strain that's high in sativa, because it's already way up there, that's going to bring that energy up. So we just have that conversation, have that dialogue, and then we encourage them if there's some things that we're like, oh, this is not going to work for them, kind of are able to, we have a lot of data, then we're able to kind of recommend other things for them that we think would help them.
Next question is, what impact have veteran advocacy groups had on medical cannabis acceptance amongst the community?
Oh, what impact has veteran groups? So I think they have a big impact. Veterans they play a big role in our community. And I think by them taking a forefront and standing up and them being our heroes, and, a lot of them have, put their lives on the line for us, and they entrusted us. So I think that, their voice goes a long way, and it's strength in numbers, and it's a ton of people who support veterans. It's a lot of veterans, and so I think it has a great impact on the community. And I'm glad that it's helping them live good, fulfilling lives, because sometimes if they don't have it, they can't even get through their day. So that may be something that happens to them in the community, where they may have a breakdown. And if you don't know they're a veteran and they're having an episode, then that may affect the community that they live in, or their families, or things like that. So I think it trickles down to not just the community, but it starts at home. It helps, keep things cool at home sometimes. But also I think they depend on it just to get through the day. So it helps the community as a whole, to me.
Great, thank you so much. Let's see, those are all the questions we have currently, but if you have one, please, again, add it to the Q&A or the chat and we'll ask. And while we wait just a few minutes or a few beats for any other questions, just some housekeeping items that I wanted to share is that if you could please complete our brief evaluation form for attending today's webinar. I'm going to add that link into the chat. And we are just so grateful for you all to attend today. And we're just so grateful for you attending this whole webinar series as well. Okay, so let me see. It looks like no other questions have come in. Great. Is there anything else you'd like to add, Teesha, before we close today?
No, I'd just like to thank you all at the Washtenaw County Health Department for the series, for taking time to educate medical professionals and the community at large. And thank you for this platform, because, you know, medical cannabis, you know, doesn't get a platform like this often. And so thank you for being on the forefront of this. This is important to us. This is an amazing plant. It is helping lives every day. And so thank you all for taking the time to just take this knowledge in, for having an open mind, for asking questions, and for doing what you do to help our veterans. So thank you all, and let's continue to break down that stigma of cannabis being something other than amazing. Have a good day.
Wonderful. Thank you so much. And with that, we will close the presentation, but please join me in thanking Teesha Montague for sharing her time and her energy and her expertise with us and knowledge. We so appreciate it. Thank you so much.
Thank you.
Great. And with